Okay, so you want to know all the cool things we learned about cardiology in medical school. So let's start. So the first cool thing we learned was clinical skills. So what we actually learned was how to do a cardiovascular exam. So this exam entails you doing an inspection of the patient like usual, but you will look for specific cardiovascular symptoms or signs. So we look for things like Osler nodes and Janeway lesions. This would point more to like infective endocarditis. You would also look for abnormalities of the chest. So you would look for things like trauma or surgical wounds, like a pacemaker. You would actually look for signs of portal hypertension like spina nevus on the chest, and things like that. Then you would move on and you would feel for a panisteral heave. Then you would also listen to all four of the valves and see if you can hear any abnormalities, such as extra sounds like an S3 gallop or S4. So an S3 gallop is actually like an extra sound, and that is very, very indicative of like a failing heart or hypertensive heart. So it's important to listen for that, or even an S4 as well. You also listen for signs of like mitral stenosis with a loud S1, or like murmurs, which can indicate like valve pathology such as regurgitation. Okay, then the second cool thing we learned in cardiology was everything regarding ECGs. So we actually learned how to do lead placement, so where to place the leads for an ECG. I'll put a picture somewhere here to show you where the lead should be placed. We also learned everything regarding how to interpret an ECG. So the first thing we learned is how a normal ECG pattern looks. So you get the P wave, and then the QRS, and then the T wave. I also put a picture somewhere here where you can see how a normal pattern looks. And then after that, we learned all the pathologies. So if there's something wrong with the atrium, you will have a problem with the P wave. If there's something wrong with the ventricles, you will have a problem with the QRS complex. So there's actually quite a massive science in interpreting an ECG. But we learned all the pathologies that you can see in ECG. So the first thing is like something simple like a bradycardia, which is basically just a slow rhythm, or a tachycardia, which is just a fast rhythm. We also learned like atrial fibrillation and atrial flutter. So atrial fibrillation is basically absent P waves, whereas atrial flutter is just like these P waves that's fast like that. We also learned like major pathology such as ventricular fibrillation. Ventricular fibrillation is a massive warning sign, and just all these squiggly lines, and that means the patient has to be resuscitated. So yes, this is a very, very interesting section, and like I said, there's a massive science behind reading an ECG, and it's very, very important because you can also see things like myocardial infarction, where the infarction is. You can see things like hypertrophy of the heart, right, left-sided. Yeah, there's a massive science in ECG interpretation, and this is very, very interesting and something that we'll use a lot, I think. So yes. Okay, so the third cool thing we learned in the cardiology block was how the heart will respond to increased demand. So increased demand can be anything from like anemia, where oxygen isn't reaching the tissues, so your heart will pump out more blood in order to get more oxygen towards the tissues, or like something simple like increase in size, so increase in your muscle mass, like a lot of increase in muscle mass, or a lot of increase in fat, or increase in size. So how the heart actually will respond is it will dilate to make the chambers bigger so that there can be more volume inside the chambers. So like a bigger end-systolic volume to increase the ejection fraction and to increase more oxygen towards the tissues. So firstly, dilation. And then if this persists for a long time, you can actually get congestive cardiac failure. So the fourth cool thing we learned within the cardiology block was the cardiac cycle and the cardiac function. So this is basically how the blood flows through your heart. So it goes, comes from the body inside your right side, down into your ventricle, get pumps to your lungs, and then from your lungs it enters the left side, through the aortic valve, inside your left ventricle, through the mitral valve to your body. And also like how the valves work and the timings of the valves, how the pressures work. So everything regarding the cardiac cycle. This is also a massive science, and it's actually quite a difficult section, and Also very interesting to learn. The fifth cool thing we learned about cardiology within medical school was everything regarding myocardial infarction. So myocardial infarction is just another name for a heart attack. So myocardial infarction or a heart attack is basically where a clot or a plaque ruptured and actually lodged within one of those small arteries supplying the myocardium of the heart, so supplying the muscle of the heart. So we learned the signs of heart attack, like your chest pain, your shoulder pain, your jaw pain, like dyspnea, so breathlessness. So we learn all the signs of like how to identify if someone has a MI or myocardial infarction, and also like how to identify a myocardial infarction on an ECG. So basically you get a STEMI, which is a ST elevation myocardial infarction. So the ST segment will be elevated. You also get an NSTEMI. This is basically a non-ST elevated myocardial infarction where there's no ST elevation. So like I said previously, the clot or plaque that's inside the artery, on ECG, you can actually like identify where in the heart the clot is, like is it an anterior or posterior artery. This is also a very, very interesting section, the myocardial infarction section, and a lot of people get myocardial infarction heart attacks, so it's very, very important to be able to diagnose and treat. So yes, this was very, very cool. So there you have it. This is the top 5 cool things we learn in the cardiology block.